In 2012, I was diagnosed with type 2 diabetes. As I got older, my feet started hurting. My name's Gary. I'm an attorney. If you can imagine trying to convince 12 people that your client's innocent and your feet are hurting and you're concentrating on, your feet and you're not concentrating on what you need to be doing. I remember having some numbness and some aching feet, and I just thought it was part of what I had to go through as being a diabetic. Sometimes when your feet are red hot, I put them in ice baths, and standing for any length of period of time it hurt. When I went to see my doctor, I told her about the pain that I had in my feet, and she told me that I had diabetic neuropathy. I don't go to games, football games. I go to my kids' grandkids' games if I have to walk a distance or if I have to stand. I can't have my feet hurting me. It distracts me from the things that I need to do as a lawyer. I couldn't sleep at night, and it just got worse and worse. I approached my endocrinologist and said, what can we do? I want to get some of my life back that I had before. She told me about a healthcare provider that was in her building that specialized in pain neuropathy in your feet. So I went to this healthcare provider. He told me that he explained why my feet had pain. He talked about QUTENZA. He applied QUTENZA to my feet and then wrapped it. Sitting there, you could feel my feet heating up, so to speak. Nothing uncomfortable. I realized that that's what we wanted it to do because it was addressing the issues of the nerve endings. After 30 minutes, the nurses came in, unwrapped my feet, took the product off my feet. After the treatment, I could notice that there was less pain in my feet, but it was maybe 48, 72 hours after the treatment. So I was looking forward to the second treatment because things were improving in my life. I was able to stand longer without my feet hurting. I was able to walk without my feet hurting. And we did it again. And lo and behold, my feet got better than they were after the first treatment. I didn't have as much pain in my feet. I could sleep longer at night. I could tell that this was a long-term type of solution. I've got a third treatment coming up, and I'm looking forward to that because my feet don't hurt right now. I'm not going to go without it being scheduled. I'll be every 3 months. Compared to the way my feet were hurting before I started using QUTENZA and how it feels now, it's kind of a life-changing event for me anyways. It's just been something that's improved my life, and I can now go see my kids, grandkids play games and stuff.
Indication: QUTENZA, capsaicin 8% topical system, is indicated in adults for the treatment of neuropathic pain associated with postherpetic neuralgia, PHN, and for neuropathic pain associated with diabetic peripheral neuropathy, DPN, of the feet. Important safety information. Treatment with QUTENZA must be performed only by a healthcare provider. You should never apply or remove QUTENZA yourself. Do not touch QUTENZA or items exposed to capsaicin. Touching QUTENZA and then accidentally touching other areas of your body can cause severe irritation of eyes, mucous membranes, respiratory tract, and skin. Do not touch your eyes or other unintended target areas during the QUTENZA application. QUTENZA is not for use near eyes or mucous membranes. Do not sniff or inhale near QUTENZA, as this may cause you to cough or sneeze. If irritation of eyes or airways occurs or any side effects become severe, notify your doctor immediately. The treated area may be sensitive to heat, for example, hot showers, bath, direct sunlight, or vigorous exercise, for a few days following treatment. You may experience substantial pain during the treatment. Tell your healthcare provider if you're experiencing pain. A cool compress or medicine for the pain can be provided to help lessen your discomfort. QUTENZA can cause serious side effects, including pain and increases in blood pressure during or right after treatment. Your healthcare provider should check your blood pressure during treatment with QUTENZA. If you have high blood pressure that is not well controlled by medicine, or have had recent heart problems, stroke, or other vascular problems, you may be at increased risk and should discuss with your doctor whether QUTENZA is right for you. Tell your doctor if you have reduced sensation in the feet. You may notice that you have less feeling for hot or sharp pain where QUTENZA was applied, but this is usually minor and temporary. The most common side effects of QUTENZA are redness, pain, or itching where QUTENZA was applied. You should tell your doctor if any side effects bother you or do not go away. To report suspected adverse reactions, contact Veritas Pharma Incorporated at 1-877-900-6479, option 1, or FDA at 1-800-FDA-1088, or www.fda.gov/medwatch. For more information, ask your healthcare provider or pharmacist. Please see full prescribing information provided by your healthcare provider or at QUTENZA.com.